According to the CDC, it came out with some new data showing that rates of sexually transmitted infections are on the rise for adults over the age of 55. So, one, what is this all about? And two, have you had to have these discussions with some of your older patients?
Yeah, you know, it's really fascinating. The rates are actually double of sexually transmitted infections compared to what they were before. Now, this sounds like a bad thing, right? But
yes,
it's not.
It does.
No, it's a good thing, right?
Well, until you have one.
Well, no, they just have to talk about it with their doctor.
Right, and that's the point I want to drive home, that even though it sounds like it's bad that we're having more infections, it means, why do you think that is? It's because people are having more sex. And that means that older adults feel empowered to have sex. Now think about our parents and our grandparents. What was their generation like? Did they talk about sex?
No, it was taboo.
Taboo. So they don't know a lot about sexually transmitted infections, and most of them only had one partner in most of their lives. So a lot of this is behavioral and social. Now some of it is biological, right? Because as we get older, our immune system gets weaker, so we're more likely to get infections. Some of it is also the environment that we're in. So we're seeing a lot of sexual activity in nursing homes. And what we see in nursing homes is that the male to female ratio usually favors many more females than males. So sometimes you have multiple partners. And again, that's another sort of point for education. And you asked me, Sam, if I bring it up, I try to open that door in almost every visit, whether it's older patients or younger patients. But it's a little different for me because I'm a cardiologist. So I know that I need to bring it up because if you have heart surgery, if you have heart disease, if you have congestive heart failure, sex could be dangerous for you. And sex is a stress test on the heart. So teaching my patients to learn about sex with heart disease is an important objective for me. But every doctor won't always bring it up. And that's not because they don't want to. It's not because the doctor is embarrassed. It's because they want to do what you want to do. We're taught in medical school to sort of mirror what the patient wants. So we ask an open-ended question. Anything else going on? What else is bothering you? And that's sort of your opening to bring it up.
Well, I was going to say, what if you're like a younger relative and you're like, you don't want to ask your grandmother if she's having sex, but like, how would you do that if...
Well, I think
you're asking for a friend?
I mean, I think talking to an older parent or an older grandparent about sex can also be a little bit tricky. But again, guys, we really have to start to establish the culture. And I think it already exists in our generation. But sex is normal. Like, you wouldn't be shy to talk to your grandmother about her headaches or her back pain or her knee pain. And so we need to start talking about sex in that way, because by not talking about it, we're actually making it a harder thing to treat and a harder thing to sort of address medically.
It is kind of weird, though.
Yeah.
How's your knee, Grams? You getting it?
Yeah.
Getting on it right over there?
Maybe, getting it.
But getting on, I said.
You said getting it.
No.
Maybe
Right,
because, okay, Grams, if you're getting it, are you being safe? And take it to the next level.
I would walk right out of the house if I had to say that.
Have a little cocktail, get some truth serum, and get Grams to open up. And I mean, we're joking about it, but I do think talking with each other is how we're going to learn about safe sex in our geriatric population.
And then you prevent all the STIs.
That's exactly right.
There you go.
Yeah. Well, if Grams doesn't want to talk to Jeff about it, I think a lot of people have a difficult time broaching the subject with their doctors. So if they find it embarrassing, how would you recommend that they do go about talking to their doctor about it?
You know, I would say that if your doctor's not bringing it up, you bring it up. And the way to bring it up, if you're embarrassed to just say, hey, I'm having problems with my sexual function, medicalize it, right? So put it in the context of something medical. Ask a medical question. Could it be the fact that I have diabetes be leading to me having trouble with an erectile function? Could my medications be causing a loss of libido? Or just say, you know, I've noticed that blah, blah, blah is happening. Could that be related to some underlying medical condition like my thyroid? So you can even put it within the context of something medical if you're embarrassed. But I would really empower you not to be embarrassed, because everything you say to your doctor, completely confidential, completely protected. And trust me, as a doctor, I'm telling you, I have conversations about sex all day with patients with all different types of questions. And I'm glad that they ask, because then I can use that opportunity to sort of teach them about safe sex and how to be healthy.
You never went out to dinner with your doctor friends and laughed at a couple things? You know what I mean? Come on.
To know that.
Yeah.
I would say there was one example in the emergency room where somebody had a beer bottle somewhere where they shouldn't, and they said that they sat on it. And that
Grandma, how could you?
That was a little bit hard to believe.
All right.
We got it out, though. It was a glass bottle. We got it out. They were trying.
All right.
I think it's important to
We assumed
kind of
you got it out,
talk
too.
about that, though, because I think some people, and this is important because not every doctor is going to be like you, and there are going to be medical professionals who you don't feel empowered to talk to because they have a sense of you're feeling judgment or you're feeling like this isn't the person that you should have shared those things with, and maybe that's a good time to look for another medical professional.
I'm so glad you said that, Erica, because if you can't talk to your doctor about sex, about end of life, about finances, about everything that's bothering you, that's not the right doctor. Then you need to find somebody else.
All right, well, let's switch it up, Doc, because we're like living in an era where there's almost like a miracle weight loss drug or drugs on the market, and you know, it's changing people's lives. But I guess some people are saying that it's not working for them. About 10 to 15% of people are saying that these miracle drugs, Ozempic, Mounjaro, are not working for them. So who might those people be, and what are their options?
Yeah, that's exactly what we saw in the clinical trials, that there are about 10 to 15% of people who are called non-responders. They don't respond to these medicines with that dramatic weight loss. Now, there's many different reasons that have emerged for that. So some could be that their sort of reason for obesity is different. These medicines work on hormones that help us to feel full, and if these people have some other reason for being obese, then the medicine isn't going to work. Sometimes people are taking other medicines that sort of counteract the effects of these. Some people are going into this treatment really, really optimized, like they're not eating too much, they're exercising perfectly, and so for them they have less return on their investment than the people whose behavior changes a lot when they start Ozempic and they start eating a lot less. And then we're learning there's some genetic differences as well, and other medical conditions you have like diabetes could affect how your body responds to weight loss. So it doesn't work for everyone perfectly, but because the majority of people, 85 to 90% are going to have a robust weight loss, I think it's worth a try. And if you're one of those that doesn't respond, then talk to your doctor about some other options.
All right, Doc, we only got a minute left, so let's get this last one in. Speaking of Ozempic, there's an Ozempic baby trend on social media where women are speaking out about getting pregnant while on the weight loss drug. So does this have to do with, does it correlate with the drug, or is it because people are looking better and feeling better? Maybe they're getting after it a little bit more?
Like grandma, right?
Yeah, like grandma, yeah.
So, I would say a little bit of both. Obviously, there's social reasons. People feel better when they have better self-esteem and less weight on them, but there's also biological reasons. So one is that we've realized that women who take oral contraceptives, pills that you swallow, they could be absorbed differently in the setting of Ozempic. It could make it less effective. This raises questions about other pills as well, to me as a physician, important questions. Should we be monitoring that? Also, what we see is if you've got a lot of extra weight on you, it reduces your fertility. So getting some of that weight off can regulate your periods and kind of really help those hormones get into balance. But getting too much weight off can actually be the opposite. So it's nice that it's having this effect, but I do want to remind every single person that it's not a fertility drug. You don't get on this medicine to have a baby, but we're just noticing that.
And you have to get off right away if you did end up.
Excellent point, because in the animal studies it's shown risk for harm, fetal harm. Now there are trials going on looking at pregnant women who happen to get it and happen to get pregnant, but we don't yet know. So definitely stop it if you get pregnant.
Good information. DBL Nation, follow Dr. Kohli on social media at Payal Kohli MD. Also be sure to subscribe to her YouTube page. Plus, check out her podcast, Heart of Medicine, wherever you listen to your podcast. Thank you again, Dr. Kohli.